Good morning, everyone. Thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference today. The holiday season is officially upon us. Last year at this time, I think we were all hopeful that the holiday season of 2021 would resemble the years prior to COVID-19, and sadly, this is not the case. Family traditions and celebrations are once again being impacted, and many of us are struggling with the feelings and anxiety this reality is creating for ourselves and our loved ones. We will be dedicating the next hour to discuss the emerging information and your questions about COVID-19, as well as the impact the current state is having on mental health this holiday season. We will discuss healthy strategies for dealing with holiday stressors that are compounded by COVID and how we can support the mental health of our family and friends. I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I'll be your moderator for the next hour. Please join me in welcoming back our expert panelists today. Dr. Jim Jarvis, the Senior Physician Executive and Director of Clinical Education at Northern Light Eastern Maine Medical Center. Dr. Jarvis also serves as the COVID-19 Response Incident Commander. Dr. Elizabeth Marnick, an immunologist and assistant professor of molecular biochemistry at Hudson University. Dr. John Campbell, Vice President, Senior Physician Executive, and Chief Medical Informatics Officer for Northern Light Acadia Hospital, and Jacqueline Sear, a certified nurse practitioner and the Director of Substance Use Services at Northern Light Acadia Hospital. Before we get started with today's panel discussion, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today, in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. This hour is intended for you, and we welcome and encourage your questions at any time using the question and answer function. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future discussions. Dr. Jarvis is going to get us started today by providing the COVID update. So good morning, Dr. Jarvis.
Good morning, Karen. Thank you. So I'm just going to kind of go over where we are right now, and we'll start at the broader view of looking at the world and kind of get closer to Maine as I go through my slides here. You can see that the United States still leads the way in the number of new cases per 7 days. So with those numbers continuing to increase, though the last 2 weeks, the U.S. kind of had a little bit of a decrease in the number of daily cases that they had. What's concerning to me on this graph, though, is to see the high numbers that we're seeing in Europe. So Germany, the United Kingdom, and France have all now jumped to the top of the list with new cases just behind the United States. And often that's kind of the bellwether for what we're going to see happen next year in the United States. Some of this is being driven by the fact that we're all very tired of dealing with COVID, and so we're letting our guard down, not wearing masks as appropriately as we should, congregating again, but also some waning immunity for people who have been vaccinated early on in the vaccination process or who were infected early on in the disease. And now we have something else to worry about, which is Omicron, which is a new variant of concern. And we'll talk a little bit more about that in detail in the next phase of our discussion. So next slide, please. So this is just a slide to highlight that across the United States, most of the country is in high or substantial spread of community illness, with Maine being red as well. You can see down in Florida, however, they have gone down to low transmission in most of their counties, and that's some good news for the rest of us. Florida lagged a little bit behind in vaccination rates, but they have caught up. And some of this may simply be due to the fact that they at one point were the highest in the nation as far as new caseloads. And so you have a lot of people who have recently been infected. And so maybe that's something that can portend well for the rest of the nation. We'll have to wait and see. Next slide, please. So here in Maine, we continue to see high rates of disease across all of our counties. And so that's important for us to understand that with the CDC's recommendations, it's still recommended that all people, regardless of vaccination status, be wearing masks while they are in an indoor space. And you can just go out doing any of your shopping, whether that be for the holidays or just for routine things, and notice that still many people are not adhering to that guidance, and that just adds to more community spread. If we start looking at hospitalizations, this was actually from a couple of days ago with total hospitalized. That was a record on that day, and we set yet a new record yesterday and a new one again today. As of today, there were over 100 patients in critical care across the state of Maine just for COVID-19 symptoms, and that's extremely concerning because typically we wouldn't even have that total number for all of the needs of our state, and so those just take up those very valuable beds and take them away from people who may need them for things like automobile accidents or for heart attacks or for complications of some of their other underlying conditions. Additionally, we set yet another record for the number of people with COVID-19 who are on ventilators. And if you remember from some of our other discussions, we want to try to avoid using ventilators in people with COVID-19. We know it actually increases their mortality. But if they're so sick that there's nothing else we have left to offer them, that's where we're at. And we're seeing again in record numbers. Next slide, please. So vaccinations continue to be the mainstay of what we need to do to try to get this pandemic under control. Maine continues to be one of the leading states in rollout of its vaccination. More than 70% of our population now is fully vaccinated. That's good news for us, but we know that those who are vaccinated very early on in our vaccination process, and that's 2 weeks from yesterday, is actually when we started vaccinating first responders and healthcare workers here in the state. We have noticed that there is waning immunity for those individuals. And so now we are recommending booster shots for anyone over the age of 18 who received either the Pfizer or Moderna vaccine more than 6 months ago, or if they received the Johnson & Johnson vaccine more than just 2 months ago. Boosters are highly advised, and now with Omicron looming in the background, even more concerning, and therefore more important for those of us who have been vaccinated for that longer period of time, get their booster shot, and for those who have not yet been vaccinated to get vaccinated. Next slide, please. So this is just a snapshot in time from Northern Light Health across our 10 hospitals, and this is from a few days ago. And you can see that at that time we had 89 people hospitalized across our system. That number has increased since then to over 90. Of those individuals, 35 were in our intensive care unit and 9 were on vents. And what I really want to point out here is that if we look at this graph between the vaccinated and the unvaccinated, we can see that still unvaccinated individuals make up the majority of cases in our hospital. And then if we kind of look at it by age, anyone who's in a hospital who has been vaccinated, and our definition of vaccinated is that they received at least 1 dose of vaccine, so not the CDC's definition for fully vaccinated. So not all of them have been fully vaccinated. All of them, however, are over the age of 50. And in fact, 2/3 of the vaccinated individuals who are now hospitalized are over the age of 65. And no one on a ventilator on this day was vaccinated at all. And so this really is a telling thing for us. Remember, 70% of our population is vaccinated, so there are more vaccinated people to get infected, and yet we're not seeing that with severe disease. And really, younger people who are unvaccinated are the ones who are at risk now from disease, particularly severe disease. So that's the concern that we see here. This does show that probably people who are older who have been vaccinated, the vaccine efficacy is waning a little bit, and therefore boosters are really important. But once again, this shows vaccination does prevent hospitalization and disease, because statistically it should be just the opposite numbers than we're seeing on this slide if vaccines were not working. Next slide. And this is really just something for all of you. This is a link to our portal, which will allow people to sign up for both a primary series of vaccine and the booster vaccine. And so this is just an easy link for everybody on the call to either use this themselves or share with their employees, staff, customers, or family members. And we appreciate that. And with that, I'll turn it back over to you, Karen.
Thank you, Dr. Jarvis. And this information is so important, and I know it's been evolving daily. We've been updating this slide every day, and it's still outdated in terms of the numbers. You had talked about the impact that this is having on our healthcare system in terms of the number of inpatients we have, the number of patients we have on critical care. Can you just give some information as to what type of planning Maine healthcare systems are doing and what discussions are being had so that we can make sure that all of our patients are cared for?
Yeah, so Karen, again, one of the things that makes me so proud to live here is how coordinated we are across the entire state of Maine. So I'll share two instances of where that's working for us. So on an every morning basis, the four major health systems in the state, so Northern Light Health, Maine Health, Central Maine Healthcare, and Maine General Health, we actually share our data at first thing in the morning. How many beds do you have available? How many patients do you have? How many ventilators? How many patients are on ventilators? And so we're sharing that so we're all aware of where the hotspots may or may not be. And at the same time, we continue to look around the state for all of our rest of our resources. Remember, it's great that we have those four medical centers, but most of our patients are cared for across the state in critical access hospitals. And if they just have 1, 2, 3, or 4 patients with COVID-19, those are 4 beds that are so precious to a hospital that may only have 6, 7, or 12 beds available to the community at large. And so we continue to discuss and figure out ways that we can help to manage. It was concerning because this high rate of disease is not only here in Maine, but it's all across all of New England. In fact, just 2 days ago, there were no available beds in the state of Massachusetts for us to transfer any patients to. And we've heard similar stories from New Hampshire and Vermont, as all of us are seeing increased cases. And then I'll show you how tight-knitted we are. Last week, or 2 weeks ago, I was presenting on Maine Public Radio, and I got a call from Dr. Shaw first thing in the morning to tell me that they were going to change the recommendation for booster shots, and he wanted to make sure that Dora Mills and I were aware of that before we went on. I can't think of another state where the head of the CDC is so in tune to what goes on in every aspect of the state that they would be making that call. And so we are so lucky that we live in a state where the state and all of our private entities work so well together. However, that doesn't overcome the challenges that we have alone. And so we need our public health help in doing that. And so vaccination, wearing your mask, washing your hands, not going out when you're sick, those are still the mainstays of what we need to do to get this pandemic under control so we can stay as a healthcare system across the state of Maine to take care of every other need that Mainers need.
Absolutely. Thank you so much, Dr. Jarvis. Appreciate that and appreciate all the work that our healthcare systems and states are doing to coordinate and do the best that we can to meet the need of our patients and our communities. At this time, I'm going to ask Dr. Elizabeth Marnick to join us as we take time to discuss this topic in more depth. And to get us started, I'd actually like to pose a question to our audience. And the question should be popping up momentarily. I hope. There it is. The question: what concerns you most about COVID-19? And I'll give you just a moment to indicate your response. Okay, Lainey, why don't you show us what the results show? It's a mixed bag here. And it's tough to pick what the greatest concern is because I think we can all agree all of these are concern. I know if I could have voted, I would have said the unknown because I'm just not good at not knowing what's to come. So let's talk about that new variant. 30% ranked that as the greatest concern right now for them. And so Dr. Marnick, I'll start with you with the first question. How and why are these variants occurring?
Yeah, so viruses are unique from bacteria because viruses cannot replicate unless they're infecting a host. So they need to be infecting an organism, whether that be a human or an animal, to reproduce and to make copies of itself. So when that happens, when the virus is making copies of itself, it does that sloppily and it makes mutations. This is a normal process that happens when viruses reproduce. Most of those mutations are not concerning. But the more we let a virus spread and infect more people, the more opportunity we're giving that virus to mutate. And just by random chance, some of those mutations will end up being concerning. And this is what we have seen with Delta. And now we have seen this with Omicron, where we know that it has a lot of mutations, but we're still trying to understand what those mutations are actually doing to the virus. There's a lot of theories being thrown around, but we're waiting for a lot more data to know more clearly. And the only way we can stop variants is to get vaccinated, because vaccinations reduce your risk of being infected. So if you're not infected, the virus can't mutate because it can't make copies of itself without infecting a host. And this is why it's important to vaccinate us in America, but it's also really important that we advocate for vaccine equity globally. Because until the world has access to vaccinations, we're going to keep chasing the next variant. Low-income countries, about only 5% of them have had access to vaccines so far. And that's not going to help the situation. So until the world has access to vaccines, we're always going to have to be worried about the next variant.
Do we know what the vaccination rate is in South Africa and the region where this variant was discovered?
So I want to be clear that we do not know if the variant arose in South Africa. There's a lot of misinformation being spread that says it arose in South Africa, but we don't actually know that for sure. There's now some evidence that it could have been circulating in Europe at least 2 to 3 weeks before it was found in South Africa. South Africa is really, really good at doing epidemic surveillance because they're very used to it from things like Ebola and other epidemic diseases. So they have an amazing genomic surveillance program. The US is actually ranking about 20th to 25th in how often we're doing genomic surveillance on variants. South Africa is in the top of that list. So South Africa does have a very low vaccination rate. I think it's in the 20s to 30%. And that's mostly due to vaccine hesitancy. So there is efforts being done on the ground in South Africa to address that. And a lot of that hesitancy is valid due to disproportionately affected populations and that have had issues arise in the medical community. So there is unique challenges that South Africa is facing. So we know that the variant was discovered there because of their expertise in identifying variants, but we're not sure if that actually arose there. It could be that what happened is that the variant ended up going to South Africa through a plane flight or whatever. And then because of their low vaccination rate, it got the opportunity to take a hold. And that's where we started noticing it popping up more.
I appreciate that. I appreciate that clarification as well as the context there. Do we know yet if the booster provides a level of protection against Omicron?
We have some preliminary data a lot of the data that this is based on people who have been infected and then have gotten vaccinated. So those have been exposed to the virus 3 times, and they have a really robust immune response. And some preliminary data from the booster is really showing that we similarly, after you get that booster dose, have a really great immune response. So scientists are really optimistic that the booster will really help us be protected against Omicron, and that's currently our best defense. But we're still waiting for data from Pfizer and Moderna, who are currently doing lab studies, to know exactly how much protection that booster will offer. But boosters definitely are the best thing that we can currently do to help reduce our chances of getting infected in general, but also from Omicron.
And also remind everybody that right now in the United States, almost 100% of cases are Delta right now. And while we do know that Omicron was just discovered in California, again, we know that the booster shots work very effectively against Delta variant, which is what we see in our communities now.
Dr. Jarvis, you mentioned we looked at the chart where it had the countries that have seen, the prevalence in the countries. And we know, and we're hearing in the news that the federal policy is continuing to evolve around travel policy. Can you speak a little bit to that? Is that good public health policy? Is that or is that optics? Because it seems as though we've been through this before.
Yeah, so the travel bans and things like that are probably more about optics, right? Because it doesn't ban all travel, it just bans specific travel, and we know that viruses find a way no matter what we do. And so even if we were to shut down all air travel around the world, eventually the viruses still make their way around the world. Because you know what, we had the same issue with influenza long before we had cars, planes, boats, or anything. And so we know pandemics continue to occur. So there's some optics there. I think it's more of enforcing rules that we know are good preventative health things. So if we're flying, everyone needs to be masked. Why? Because you're in a confined space right next to another individual. Even though the air transfer inside a Airplane is actually better than just about any office building that any of us work in, because airplanes, that's the way they're designed. They suck in air from outside to make the turbines go and refresh the air inside the plane. So the air is relatively safe. It's the close proximity that's the issue. Plus, when we travel, we then have to be at the airport for hours, and we have to be, we go and eat, and we do all these other things. So that's really where transport kind of, affects disease spread. Really, for us here, it's community spread that we should all be worried about, not the next airplane that lands. It's the person that's next to you while you're in line buying your groceries. And so again, trying to get as many people to follow good public health measures of wearing masks while they're indoors in a public place, washing their hands, and staying home when they don't feel well is really, really important. And if you don't feel well and you have symptoms of a cold, influenza, or COVID-19, you need to get tested so that we can know who and where people who are positive for COVID exist. And I know it's a challenge to get testing done, but it's important for us. Dr. Marnick really, hammered home. South Africa is good at this. They can go in and test when they need to test. We are not good at that, and that becomes a problem for us in trying to do things. The other thing that South Africa has been wonderful about is sharing their data. I'm not so sure every other country has been forthcoming with all of their data like South Africa has. So we should all be applauding what's happening there and not disparaging. I did want to just answer really, really quickly the one question in the chat there from Aaron around the transmission in Florida being low. Florida took a different approach than the state of Maine did. We kind of took the approach of let's flatten the curve, which means that we will expect that we will have disease for longer, but we won't have as many people at the same time. Florida didn't quite take that approach. If you look at their mortality rate versus the state of Maine, even now, while they have much fewer case counts than per capita than Maine has, their mortality is still higher than Maine. Only time will tell which one of us did the right thing, but in our role of trying to protect lives, I think that Maine's approach was a much better approach, even if it meant that we were inconvenienced for a longer period of time, because I'd rather be inconvenienced than know that a loved one of mine died. And that's really what we're trying to do, is prevent deaths. So that's my commentary on that. Time will tell whether my commentary is correct.
Well, I appreciate that, and I actually appreciated that comment. That was going to be my next question about that, because I did see a post on social media about that, and that's a lot of people are using that as a reason not to get vaccinated because Florida's public policy was so different. But I think it's important that what you said during your presentation is their vaccination rate has actually improved quite substantially, right?
It has. What they did was they didn't come forth like we did, saying vaccines were the most important thing, and nor did they follow a policy around masking like most of our school districts did. I think that was more political than actual what was happening on the ground. People in Florida took advantage of the fact that the state paid for their vaccination program, unlike what happened here in the state of Maine. And so that they're seeing the benefit of that, but they had a tremendous disease burden. And so now they have the mix of people who are vaccinated and people recently infected. That's going to drive down your rates of infection as well. But mortality is still high, and that's what I'd rather prevent.
Yeah, absolutely. I want to thank you both for taking the time to chat briefly about this. You both will be back in a little bit to continue to answer questions from the audience. So rest assured, continue to submit your questions, and we'll make sure Dr. Jarvis and Dr. Marnick have time to address them as they relate to COVID-19 at the end of today's presentation. It's certainly something that's impacted, I think, a lot of our mental health. It certainly has impacted mine. I'm not ashamed to admit that. I think it's impacted the mental health of many of our employees. And so at this time, I'd like to invite our panelists from Northern Light Acadia Hospital to join us, Dr. John Campbell, Vice President, Senior Physician Executive, and Jackie Sear, the Director of Substance Use Services. And while we transition, let's pose another question to our audience. As an employer, what concerns you most about your employees' mental and behavioral health? And Landy, let's take a look at the responses. Wow, burnout. Absolutely. I think so many of our employees have been on screech, dealing with a lot of stressors personally and professionally, and I can see why burnout would be the top. And I'm sure I'd be curious to know, Dr. Campbell, is that a surprise to you?
No, it's not a surprise to me.
Yeah, I wouldn't think so. Historically, Dr. Campbell, when we're looking at the holiday season, I believe the trends have historically been relatively higher during the holiday season. Have you found that COVID has compounded that?
Well, it has. And let's think about how our lives, the cycle of our lives over the course of the year. And as we approach the holiday season, we all know people who approach the holiday season with great enthusiasm. They're kind of like the winter people. Their houses are decorated. I got my first Christmas card in the mail today. I'm like, what the heck? I've got to do Christmas cards. They ski, they snowshoe, they ice fish. Good for them. We know them. For others, there's less sun. It's cold. Our activity levels go down. We have to start planning for the family gatherings. We have to spend more money on heat and gifts and food. We drink more. We eat more. We gain weight. We know it. And now add COVID to the mix that your family gatherings could actually kill you. You could get COVID shopping for gifts. You get your gifts coming to your door, people start stealing them perhaps. That happened in my neighborhood yesterday. So it is a challenge for people. And now that we're aware that we're going into this with a lot of fatigue and a lot of burnout. So wellness is at stake. And wellness needs to be valued, understood, and prioritized.
Thank you so much. I think so many of us have lived exactly what you described there. No matter which side of the spectrum you are on, I tend not to be a very decorative person. So if that's telling to you how it impacts me on an annual basis, and certainly COVID's had an impact. Jackie, the next question is for you. It's very common to hear people say that they enjoy alcohol or other substances because it helps them relax during times of high stress. Assuming that more people are feeling more stress during the holiday season, as Dr. Campbell explained, how do you respond to that?
My first response is, how so? And then tell me more about that. And so in that information that you obtain in that time is a way that you can help the individual navigate towards healthier means of dealing with the stress of the holidays and the darkness and all of those things that Dr. Campbell just spoke about.
Yeah. I think that holidays are a time of celebration, and alcohol is certainly something that people enjoy to celebrate the holidays. But what is the tipping point? What is appropriate? When do you know you might have a problem?
So as healthcare providers, when we're digging into that and looking to see if someone has a use disorder, if you will, we have 11 questions that we ask, and how they score on that is where you pick or choose what the significance of the disease process is. But when you're speaking with someone just in general, the question is your use of alcohol, which is the most socially acceptable substance of abuse, and the incidence of alcohol around the holiday time being extremely high, is it causing you any negative consequences within your everyday life? So if you answer yes to that, that is where we need to start paying attention. And how do we help you navigate, or the individual navigate through that? And also just remembering that anything that brings pleasure to the human mind and body has the potential to be a use disorder or an addiction, and that can be any substance.
Dr. Campbell, and a follow-up to that, and also to our poll question, interested to hear your thoughts on what an employer can start doing to support an employee's mental health.
Well, employers need savvy managers, and savvy managers need to identify who on their teams are struggling. They need to connect with those individuals, and they need to help guide them to support and help.
And I think that is makes sense, but to have savvy managers, how do we equip them with the tools necessary to provide an environment where their employees feel comfortable in that relationship and trust that relationship enough to speak up and express that they might have an issue or problem. And I throw that to you, Dr. Campbell, but I'd also invite Jackie to chime in as well.
Sure. Well, you actually have to train them that that's a skill. Wellness maintenance of teammates is a manager skill. And in general, when it comes to, psychiatric conditions, mental health conditions, our instinct is to avoid it. They need their space. I don't want to embarrass them. There's a program that DuPont developed called ICU, which actually trains managers to identify depression, anxiety, bipolar disorder in the workplace, and also how to have that conversation to engage the person, and also ensures that employers have opportunities for their employees to get help conveniently and locally, employee assistance programs, for example.
Thank you. Jackie, do you want to add to that?
I
can tell.
I do. I think that it is absolutely an important place to start with, just having that open door, that welcoming environment. Some of us are much more comfortable leaning into those uncomfortable conversations. Some of us just naturally flow with it. And it's not uncomfortable for us. And it's just natural to say, hey, I talk with my hands a lot. So the people that work around me are used to me going, what's going on right there? Like, what was that, right? So as you are working with your staff, absolutely, formal training for managers, but the environment, the culture of caring is so, so important. And if you aren't comfortable having that conversation, that's okay, but make sure you're armed with information so that you can support somebody. So as employers, the more information you have out there, if it's in the break room or on the bathroom door, or hey, if you're struggling with, it's not just for the individual themselves, but these disease processes, mental health, substance use disorders, they're co-occurring, they go together, and they don't impact just the individual. So it may not be that individual specifically, but a family member, a coworker or whatnot. So post the information, have policies, be okay with asking questions. Hey, are you okay? I'm noticing things aren't quite right. If you need anything, you don't need to speak with me about it, but if you need something, these are some outlets we have. Use our EAP and so, whatnot. But sometimes just that, hey, you doing all right, is what someone needs in that moment to say, somebody saw me today.
And you both spoke of the tools, the EAP and some other references, benefits, for instance, that might have some mental health supports. I think it's essential, wouldn't it be, that an employer make sure that their managers are very informed of what those tools in their toolkit that they have available to them are, because some managers are going to be more comfortable having these conversations than others.
Absolutely. And I think one thing that's important is that not all of our community employers have EAP and those types of resources. So this is where it's really important to know about what's going on in our community and use our community collaboratives to support. So if you are a small business and don't have EAP or whatnot, see what's going on in your communities.
Yes, and those resources are right there for you. We'll keep those up as we continue this conversation, because it's important to have those tools top of mind and readily available. I had the pleasure of listening to Tim Dentry's Tim Talk. And for those of you who may not know, Tim Dentry's Northern Light Health President and CEO. And he does these Tim Talks on diversity, equity, inclusion. And this last episode was around living with mental illness. And it was amazing. Dr. Gavin Ducker was the guest. And I encourage everybody to listen to it. But one of the things that Tim said in closing, and it connects to what you shared, Jackie, is that to create a culture of caring, it first starts with caring for yourself. And it was such a moving, it stuck with me. And so let's talk about self-care a little bit. How can employers encourage self-care among their employees? What self-care strategies might you share for those of us who are currently struggling?
I love this topic. So self-care as a whole, we as leaders, we have to take care of ourselves and show those that we are leading from in front, behind, beside, that we're doing it. So it's okay for them to do it too. And so all eyes are on, right? And it's not do as I say, do as I say, not as I do kind of thing. It's we need to be role modeling that. And that's with setting boundaries. Right? Set some boundaries. What's healthy, what's not healthy for you. Maintain a healthy support system. Set it up so I can say, hey, Dr. Campbell, if I'm seeming a little off, just give me like a little something, let me know, or vice versa. Be selective with your time and where you're giving that up. Our time is so precious, and we are all carrying a lot right now with everything that's going on. So if you know that something's not as high of a priority, but it's going to drain a lot out of you, don't do it. That's okay. Know what your triggers are with your stress levels. Be mindful of what you're thinking. We're in control of our thoughts. If you catch yourself going down a certain path, it's okay to go, oh, wait a minute, self-check, got to ground myself, do a little breathing with that. Just being really healthful in the sense of exercise, breathing, making sure you're getting adequate sleep and nutrition, and outlets. Don't isolate. If you find yourself isolating too much, some of us are introverted by nature, and that's okay, but there's a difference between introversion and completely shutting down. So paying attention to those things also is super important. And realistic
I'm sorry, Jackie.
No, that was my last one, Dr. Campbell, I promise, was realistic expectations of ourselves, right? Tag, you're it.
That's a great response. And I'll just add to that, just a personal experience, in the workplace. I once had a position where I led a really great team of physicians. And I felt that as the leader, I had to be working the hardest. I had to show the example that, I'm not letting you all do the work. So I have to work longer and harder than my team does. Well, of course, what's happening is my team is looking at me and they're like, I have to keep up with that. That's the model and the standard he's setting. So as they're trying to keep up with me, they're getting burned out. I'm recognizing their burnout, not my own. So I'm working even harder, thinking that I have to keep them from getting burned out. And hey, where that leads. So light dawns over Marblehead, as we'd say in Massachusetts. So I realized that as a leader now, I have to model self-care and wellness to people. And I've taken the complete opposite approach to that. And I've had that talk with colleagues who now I can tap them on the shoulder and say, by the way, your hours that you're working, your people think that's what they're supposed to work now. And that's not a sustainable arrangement. You have to show them that you can walk out of the building at 4:55 p.m. and not feel like you need to sneak out the back door because you're a slacker. And
True.
It took me a year of sustained effort to transition to that, but it's paid off for me and for my my teammates. And I've made wellness preservation very much part of my leadership toolkit. And
I appreciate you sharing
consider
that. I appreciate you sharing that, Dr. Campbell, because I think that we've all fallen into that trap. And so you're speaking your truth and your experience there, and I'm thinking to myself, that's my truth and that's my experience, and I know I do that, I feel that, and so it has to be intentional, right? Recognizing that and being intentional about making those choices that are healthier.
Absolutely. I was ashamed to leave at 5 p.m. Can you believe that?
Mm-hmm.
Not anymore.
I can.
I
I can.
celebrate it, but that's tough. You got to make those changes.
Absolutely. So we do have a question here. How does a manager get the work done while preserving wellness? So I'll throw that one to you, Dr. Campbell. How does a manager get the work done while preserving wellness? Because there's so much work.
Yes. All right. And that's correct. So survival skills in the modern workplace. Number one is, in my opinion, email management. I think that email is like a water torture sometimes. They just keep flying in. So I think figuring an actual active strategy for how do I handle email. In the old days, for me, it was, I can't do email during the day. I'm too busy working too hard, keeping everyone from getting burned out. So after dinner, I'll go back on my computer and then I'll go deal with my 125 emails coming in. Not a good idea. And discussing with your team. Look, folks, don't copy everyone on a yes answer to an email. Or the dreaded, don't copy the 350 people to please take me off this email list, which creates this chain reaction that lasts about 30 minutes on your computer. You have to take breaks. You have to have time to think. Thinking is actually working. It's not something I used to understand or appreciate. If I wasn't physically working and I just had a break and I was thinking, I'm like, well, I hope the boss doesn't see it. I'm just sitting there at my desk, just not moving physically. Away from work, working on your relationships so that there's something that you look forward to returning to. Sleep hygiene, how you're managing alcohol, all of these things that contribute to wellness. Some people like to meditate, some like to listen to music, some like to pound it out on the treadmill or on the streets. But how you manage the work is really how you manage yourself 24/7, 365. So I think we all know the areas that are the particular, burrs in our saddle, and we can't accept them that way. Now, it's hard if you're in a group surrounded by type A personalities, and that's what they do, because we do have this kind of tendency to keep track of each other. But even a discussion with a team, if you feel that it's really, our team is just burning, running the engine too hot, folks. It's just, we're not setting a good example for the other team. And that's really not how we should be supporting each other. But I think that you can see it's not easy. You can't just wake up tomorrow and say, you know what, I'm having wellness at work from now on. I'm going to get de-stressed. And it sometimes takes more than an individual. And you have to check your own mental health care, because maybe you've got an anxiety problem or a depression or something like that. So complicated, but so important.
It is so important, but I can see that the benefits of if an employer were to be intentional and really look at the strategies you've just mapped out so well, I think you could really make an impact in creating a culture of caring that supports the mental health and well-being of your employees. So I really appreciate you sharing that. And I will say that it's a perfect time to transition. At this time, I'll invite all of our panelists to turn on their cameras, and we'll continue with a Q&A session and have all four of you available for that. And we'll do that and pose the last poll question for our audience. And it's about the holidays. Are your holiday plans going to change this year because of the new COVID variant and rising cases in Maine? And we'll go ahead and share the results. 33% yes, 43% no, and 24% are still undecided. And so, Dr. Jarvis, the question to you, what should families consider this holiday season as they make plans? How can they stay safe?
Yeah, so first and foremost, you have to consider everybody that's going to be at a gathering, right? We're all unique individuals, and we all have our own risk versus benefits that we have to kind of discuss. And so I look at who's going to be in the room with me. Is it going to be somebody who is immunocompromised? Is Uncle Charlie, currently undergoing cancer treatment? Is it best for us to get all of the whole entire family together, or maybe just keep that small bubble that he's always had around him there? Are there going to be small children who we know can be carriers of the virus and show very limited symptoms, going to be gathering and jumping in and around everybody? And how much of the importance of the need is when we start talking about well-being and self-care? Sometimes you take the risk because, hey, we need to have that physical, intimate contact, and sometimes it's it's not worth the risk that this is going to cause disease. And then we have to be prepared for having those difficult conversations. So many families around the country now are sitting there deciding, are we going to have only a vaccinated Christmas this year? Meaning that when we're going to get together, everybody needs to be vaccinated, and maybe even add to that, everybody needs to be boosted. That's a difficult conversation. Are we going to wear masks? Many people struggle with that over the Thanksgiving holiday, because it's a holiday around eating. And so my recommendation there is, if you are still going to get together and not everybody's vaccinated or somebody is at risk, wear masks before the meal and then spread out. Maybe this isn't the time to just, to have that clustered adult table and the even more clustered kids table. Hey, let's spread out. Let's not do the fancy place settings. Let's all have card tables or whatever so we can spread out throughout the location so we're not right on top of each other. So those are all the considerations. And then the consideration around travel, as we talked about before. Is it worth the risk, knowing that you're probably going to come in contact with somebody for your particular family? And only you can answer those questions. And so I recommend that families just be open and honest with each other, why they're doing the things that they're doing. I recently had a patient who unfortunately was just diagnosed with cancer. He just started his treatment. They had a very, very big Thanksgiving set up. He elected to just tell the family, hey, listen, you guys continue. I will Zoom in. That worked for their family. And having that conversation before the event made it a lot easier for the event to occur.
I would add, I get my news feeds. I don't know where they come from, but Dana White, who's the president of the UFC, is from Maine. And I just saw he brought his entire Las Vegas family to Maine for Thanksgiving. A member had COVID, and 100% of both families tested positive for COVID for a Thanksgiving gathering in the state of Maine. So I don't say that to make people paranoid, but as Dr. Jarvis pointed out, we have to be mindful.
Can I add one thing too?
Absolutely.
I like to remind people when people ask me this question that one of the most helpful things is to think about layers of protection. So vaccines are one of the most important layers of protection. So if everyone is vaccinated, that goes a long way at helping to reduce risk. But then we also know that other things help. Masking, like Dr. Jarvis already mentioned, is a great tool. Going outside. So maybe you want to get together with your family and bundle up around a fire outside. That's still a great way of doing that. Increasing ventilation if you're inside. So opening some windows, even though it's cold, doing those types of things can really help mitigate risk, as well as some people have started using rapid testing. Rapid testing is not perfect, but research has shown that it's very accurate at detecting people when they're contagious. It's, again, not a 100% guarantee, but if you're layering vaccinations and masking and ventilation and rapid testing, those are all ways that together can combine to decrease risk. But it is important to think about the fact that who's already at the party, as Dr. Jarvis mentioned, what's their risk tolerance? And then if people are traveling from out of state by plane, that's going to increase their exposure. That's going to make them more risky than if you're meeting with 5 people who are in the same town as you who don't have to travel. So those are types of things you can think about, and layering protections is really helpful at decreasing that overall risk.
Thank you so much, Dr. Marnick, for that. And you mentioned masking. We talk about masking. I think every time we have a Zoom conference, we continue to stress that importance. And there's a question here, Dr. Jarvis. Any chance that masking will once again become required in the general public? That was a state mandate at one point in time.
Yes, that's always a possibility. I will remind people that the governor had the authority to do that under an emergency declaration that has since expired. So she does not have that authority right now. She would have to reinstitute the emergency declaration and then start putting in mandates. We have heard, certain municipalities across the state considering doing that in their own area. We know here in Bangor, where the Cross Insurance Center is owned by the city, they do have a masking requirement in that facility because of the fact that it's owned by the city. And so those discussions happen. I think everybody on the political side of things would just prefer people just do the right thing, but sometimes that doesn't happen, and sometimes the government does have to intervene, and we need to be accepting of when those kind of things happen because they're listening to as many public health experts as they can. I would prefer us, just as a collective community to say, hey, this is Maine. You see that people come from outside the state because of how well we've managed things. We just need to continue to do that well and probably a little bit better. And if we think about ourselves as a member of a community, sometimes that's an easier message for why we wear masks and things like that. I can tell you, I wear masks when I go into a restaurant, into a store, somewhat in solidarity for their staff. Because they're the ones coming in contact with all of these other people, which is exactly what we have done in healthcare and why we have mandated masks for quite some time, not only just for the COVID incident, but last year during some of the influenza as well.
That's a good point. And Dr. Jarvis, I too have felt that way when I've gone into the store wearing my mask. It's almost like I say, I have your back, when they're checking me out. So I appreciate it. I'm not the only one that feels that way. So Dr. Marnick, question for you. And I think we've addressed this before, but I think it's so worth addressing again, because those who are opposed to the vaccine continue to say, and more with these variants, all of these people getting vaccinated are getting COVID. The vaccine doesn't work. I told you so. I'm not getting the vaccine. What is the response to this? Because it is true, we are having breakthrough cases of COVID.
Yeah, so I think some of this is also just bad messaging on the part of certain individuals, because it is true, breakthrough infections happen all the time with any vaccine. So no vaccine is 100% protective. But we don't hear about things like measles or smallpox or rubella because those things aren't circulating at high levels in our communities. If they were, we would also have breakthrough infections with those vaccines because no vaccine is 100% protective. The main goal of these vaccines were to decrease severe disease. And we are seeing that they are doing that job remarkably well. They are helping to save lives. So yes, people may still become infected, but they are not ending up in the hospital. They're not ending up in the ICU. They're not ending up dying. And we know from research that people who get vaccinated are much less likely to go on and develop long COVID after being vaccinated, even if they're a breakthrough infection. So yes, breakthrough infections happen, but it was never the goal to 100% stop all infections. And I think people think that that's the goal, but no vaccine has that possibility. And that's just because everyone's immune system is different. We all have different genetics. We are all not going to respond the same way to vaccines. So the goal is to prevent people from dying. And we're seeing that they're doing that remarkably well. But even so, if you just look at infections, it is still much less likely that you'll be infected if you're vaccinated compared to somebody who is unvaccinated. So even though we have more people who are vaccinated, we are seeing more people who are unvaccinated getting infected than those who are vaccinated. And this is true in any area of the country or the world who are tracking breakthrough infections. San Diego County is doing some of the best breakthrough data tracking, and they see time after time that it's the unvaccinated who are getting infected much more than those vaccinated. And then when you look at severe disease and hospitalization, that's even more true. It's those who are unvaccinated who are getting the sickest as well.
Appreciate that. And, talking a little bit about breakthrough, and I certainly have known folks who've followed all the rules, or they thought they had, and they still have gotten COVID. And it's quite common and becoming more so because of the current state, where people are feeling almost a sense of shame or stigma when they do become COVID positive, because they've felt as though they've done everything they can to protect themselves and protect their families. And so that's a pretty strong emotion and reaction. And I would invite Jackie maybe to contribute to the conversation here, because certainly stigma is something that is common around mental health and substance use. And how do you advise people who are feeling that sense of shame, and what kind of supports can we surround these folks with to help them through that?
We are seeing a lot of that. And it, stigma. So I really encourage people when they're expressing these feelings to just know that none of us are immune to this. As Dr. Jarvis and Dr. Marnick has said, at any given moment, it could be any single one of us. And I really channel that into the conversations we have with folks around depression, anxiety, and substance use disorder, right? COVID's not discriminating, and it's not, and neither does substance use, and neither does mental health, right? So know that none of us have all the answers. And you do what you do with the best information that you have, and that, you know what, stuff gets too heavy, you need to set that down, and in the moment do what's right for you. I don't have the answer to a lot of those questions. I just know that sticking in the negative emotion, that shame, blame, and guilt, it never does any of us any good. So once you've acknowledged the problem and you've done what's best for you next, under the advisement of your providers, move forward in that, you know, and just continue to shine the light on all of this information, that of the work that you guys are doing on the state level and getting the information out there. And then we just need to work to be kinder to each other. You know, support.
Kindness goes a long way. Dr. Campbell?
Yeah, my message to the staff, it's probably an oversimplification. There's two kinds of people that get COVID, the irresponsible or the unlucky. You can control the irresponsible by acting responsibly. You can modify your luck and fortune, but probably can't eliminate that. So if you get COVID, consider yourself a responsible person who was unlucky, unless you weren't, in which case it's a very painful lesson to learn.
Thank you, Dr. Campbell. Dr. Jarvis, I'll throw you the last question because I'm hopeful that it will be a hopeful message. Well, we'll see. That we've talked before about transitioning to an endemic and really thinking that that might be the future state. Do we have any hope right now that that is going to be in the future?
Yeah, it's a great question. First, I'm going to say that I'm going to steal Dr. Campbell's last statement, and you'll probably hear me say it on the news because I loved it. That was great. We do. I recently was asked to help try to set up some projections for Northern Light Health and then in Maine in general about where we're headed. And when I could do the next 2 weeks probably fairly close, maybe 4 weeks as I started to get out, and they asked me to project all the way through February. And my interval there, just at Eastern Maine Medical Center, was to say we could have between 10 patients positive for COVID and 90. And somebody pointed out, boy, that's a wide gap. And I said, yeah, do you know how many variables that we have to go through for that? But I had a list of what gets us to the 10, which is where we start talking about we're endemic, right? We know that this is going to be a virus that's going to be circulating with us, much like influenza, that we just have to deal with and hopefully deal with in a very small way. Vaccination and boosters, we need to get those rates up. There is no doubt about that. 70% sounds like a great number, but we need that number to be 95% now with how much disease is out there and with new variants that may cause more severe disease or at least be more infectious. And so that's the number one thing. And as Dr. Marnick says, that's not a Maine thing. That's not a U.S. thing. That's an entire world thing. We are a global economy. It doesn't matter if you're the richest nation in the world or the poorest nation in the world. We all interconnect. And so we need that struggle needs to happen. And so when you hear people say, why are we giving stuff to some other country? We're giving it to them, and that protects us. So that is the one thing. Then I think we have to get rid of this politicalization of a tragedy that's occurring right now. And that's probably going to be even harder than getting our vaccination rates up. I have had many people who publicly have said, I'll never, ever get vaccinated, who are absolutely vaccinated now. It's just because of the dynamics of where they live, work, play, and everything else. But so we need to get that vaccine. But this politicalization makes it so that we're having discussions that we shouldn't be having when we should be having questions about science, facts, and data. It's just like we talked about with Omicron. There's so many unknowns. And so here we are saying we don't know, and somebody else will then take that and say, see, the scientists don't know what they're talking about. No, we do know what we're talking about. We only talk in facts and data. And so we will not say things that we don't know. So when you hear us saying masks work, vaccines work, it's because we have data that support those kind of things. When we didn't know, we said so. Masking is a great thing. I continue to hear Dr. Fauci said we shouldn't wear masks. No, what he said was we don't know if masks are effective and we need masks for our healthcare workers and first responders. Now we need them for everybody. So that's my end. If we do the right thing, yes, we can get this under control, and hopefully we'll have a much brighter spring this year than we had last year.
I sure hope so. Thank you so much, Dr. Jarvis. And get your vaccines, get your boosters. The information, we've provided some information to you right here, and also some guidance on where you can get your booster. So please visit that if you haven't already. Just a reminder, you'll find recordings of all of our Zoom conferences on our Northern Light Health website. And I hope this hour has been a support to you, your employees, and your communities. I know I have certainly found it very fascinating. So I appreciate all of our panelists. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on December 16th, when we will continue to focus on healthy holiday seasons while providing tips for building new habits with the new year approaching. We will send you a link for this session, and we encourage you to share the invitation with your friends and colleagues. We certainly hope you are able to join us as well. By working together, we will keep Maine safe. Thank you, and we wish you all a happy and healthy holiday season. Take care.